This is the Registered Behavior Technician course presented by Shaza Attar. The course content was created by Shaza Attar and is the property of Autism Therapy and Training, Inc. All rights are reserved. This training program is based on the Behavior Analyst Certification Board 2018 RBT Task List 2nd Edition and is designed to meet the 40-hour training requirement for the RBT credential. The program is offered independent of the BACB. Remember, in each class, we will have our active listening, a quiz, and a competency assessment. I want you to imagine something for a moment. Imagine you and a coworker are working on something together. You divide up the work and you have to show your completed work to your supervisor by the end of the day. So you work really hard and do your part to perfection, but you notice that your coworker didn't really do the work well. Theirs is sloppy and not complete. Your supervisor comes over to review the work and gives you both a trip to Mexico for the work that you did. How does that make you feel? What are your thoughts on that? Well, if it were me, I'd say, well, it's not that fair. I did such a great job and worked so hard, but the person that didn't do such a great job got the exact same reinforcer as me. Well, next time I may not work as hard. Why bother? Either way, I'll probably get the reinforcer. I want to introduce the concept of differential reinforcement. What is it? What is it used for, and how to implement it in practice? I find many have a hard time using it. But if you understand it well, you'll understand why it's so important to use during teaching and learning. So, what is differential reinforcement? What is it used for, and how do we implement it in practice? Let's get started. Differential reinforcement is an operant procedure. So unlike an antecedent strategy where we alter the antecedent, here we are altering the consequence. There are two parts to differential reinforcement. The first is reinforcing the desirable behavior, and the second is using extinction and no longer reinforcing the undesirable behavior. Let's go back to our example of you and that coworker that both got reinforced for the work that you did. Although your team member didn't do the work just like you, they were reinforced the same way. Their sloppiness, incomplete work is in essence being shaped up, and it continues to exist because it's being reinforced. Although you were reinforced as well for your great work, and you would think that your behavior would continue at the same level, well, it may not. Which is easier, doing the work to perfection or giving a half-completed, sloppy project? Remember, as humans, we tend to like things that require less effort on our part. So if the work is sloppy and it gets reinforced, then why not? Think of your learners for a moment. You want them to sit down and do their work at their desk. If they stand up, walk around, look around the classroom, or talk to their peers and still get the reinforcer, then why would they need to improve their behavior? It's essential to reinforce the desirable behavior as much as possible, as quickly as possible, with the most amount of the reinforcer. Think of frequency, immediacy, magnitude when you're reinforcing, and it's essential to stop reinforcing the undesirable behavior. If the correct behavior does not get into contact with reinforcement, then that behavior will not shape up or improve. Think of your learner who is answering WH questions. You ask, "What flies in the sky?" And as you're asking the question, they're verbally scripting, engaging in verbal stereotypy. Then they quickly respond, "Bird," and they go back to their verbal stereotypy. Well, what's getting reinforced here is the response, but also the verbal stereotypy. If you wanted your learner to stop verbally scripting while you're talking to them, then you'd have to teach them that by not reinforcing the vocal script during this time. If you have a learner that is engaging in escape behaviors from the table and you allow them to escape and access their reinforcer, well, then they don't need to improve their behavior to get access to the reinforcer, just like your sloppy team member. So you need to think about how you can ensure that access to reinforcers are contingent upon desirable behaviors and not provided upon unwanted behaviors. Differential reinforcement is used to decrease problem behaviors, and it is effective. When working with learners, whether they are typically developing or individuals with special needs, shaping their behavior using differential reinforcement may be a better approach than using punishment. Most often, teachers or parents may use punishment because it decreases behavior, but when you understand differential reinforcement, you may find it to be a more positive approach. Differential reinforcement is widely used in our field to decrease many different types of behaviors. So research has shown the effectiveness of its use. It has been used in dealing with destructive behavior, dealing with escape-maintained destructive behaviors, treatment of vocal stereotypy, dealing with needle phobias, and so on. There are 4 types of differential reinforcement. There is differential reinforcement of incompatible behavior, DRI, differential reinforcement of alternative behavior, DRA, differential reinforcement of other behavior, DRO, and finally, differential reinforcement of low rates of responding, DRL. I want to discuss each one in more depth so you can differentiate between the 4. Let's start with DRI. Differential reinforcement of incompatible behavior is what the name suggests. You're reinforcing a behavior that is not compatible or that conflicts with another behavior. It weakens the problem behavior while strengthening an adaptive behavior. Here, you're reinforcing a behavior that cannot occur at the same time as the problem behavior, thus making it incompatible. For example, a learner that is in their seat and you reinforce them for being in their seat cannot be reinforced for being out of seat. In-seat behavior is incompatible with out-of-seat behavior. Dixon and colleagues in 2001 used a DRI procedure to reduce inappropriate vocal utterances. They attended to participants' appropriate verbal utterances and ignored the inappropriate utterances. They found that appropriate vocal utterances increased while the inappropriate ones decreased. A DRI can be used to decrease out-of-seat behavior by reinforcing in-seat behavior, inappropriate vocal utterances by reinforcing appropriate vocal utterances, and off-task behavior by reinforcing on-task behavior. A learner cannot sit and stand at the same time, so reinforce when the learner is sitting and do not reinforce when the learner is standing. A learner cannot be jumping or fidgeting in their seat while sitting still. So reinforce sitting still, hands down, bottom on the chair, hands in their lap, and don't reinforce when the learner is jumping or fidgeting in their seat. This diagram shows a learner at the table. They engage in jumping in their seat to gain a teacher's attention. If the teacher provided attention for in-seat behavior, the learner would no longer need to engage in the problem behavior. What is the behavior of interest that you want to increase? The behavior needs to be defined. What behavior do you want to decrease? Define that behavior. You'll need to set an appropriate time to reinforce the occurrence of the desired behavior. For example, every 2 minutes. If the undesirable behavior occurs, what happens? Maybe the timer is reset, and the time needs to be extended gradually over time. So let's practice. Imagine Johnny engages in out-of-seat behavior. Data shows that he gets out of his seat every 25 seconds and roams around the room. The teacher will often guide him back into his seat. So what is the behavior you want to increase? If you said in-seat behavior, then you're right. So in-seat behavior would be that Johnny sits in his seat with his legs under the desk. What's the behavior that you want to decrease? If you said out of seat, you got that one right too. Remember, he's walking around the room rather than sitting in his chair. In a DRI schedule, we want to decrease walking around the room. This is the out of seat behavior. So what's an incompatible behavior? Sitting or in seat behavior. Remember, you can't sit and walk at the same time. So Johnny was walking around every 25 seconds. So how long would our DRI interval be? Well, we want Johnny to be successful. So if data showed 25 seconds, we want to set our DRI interval to slightly less than that. So maybe we could set it to 20 seconds. Remember, we want to catch and reinforce the in-seat behavior. If we don't reinforce it, we can't improve it over time. Now, if the problem behavior occurs and he gets out of his seat, we can redirect him back to the table and restart the timer. He won't get access to his reinforcer until he successfully sits for the predetermined time. Now, what's the reinforcer? Was anyone wondering about that? So, this depends. Is Johnny escaping the work? Is this attention seeking? Does he want to play? So the FBA that was conducted will determine what the function of the behavior is. So you can give Johnny time away from the table, you can give an edible, you can give him access to the iPad. The DRI protocol will be written by your supervisor, but your job is to understand what a DRI is and how to implement it. So you want to reinforce the behavior that is incompatible with the unwanted behavior. You want to compete with that problem behavior with something that the learner cannot simultaneously do. Here is Sonia. She's 5 years old and she loves to sing and do her work. The singing is loud and it disrupts her peers. If you tell Sonia to be quiet, she'll stop singing for about 5 seconds, then start singing again. So what behavior are you trying to increase? If you said the quiet behavior, you're absolutely right. What behavior are you trying to decrease? If you said singing, you're right. So now we need to compete with singing. Well, she can't be quiet and sing at the same time. She can't answer questions and sing at the same time. So the DRI would be set to compete with the singing behavior. Let's continue. All right, let's do a Scrabble word before we move on. And the word is orzo, O-R-Z-O. And this is a type of pasta. All right, so let's continue. Let's talk about differential reinforcement of alternative behaviors. So this is when you reinforce a desirable alternative behavior while the problem behavior is no longer reinforced. The alternative behavior does not need to be incompatible. The alternative behavior can be used to occupy the time that the problem behavior would typically occur. Lerman et al. 2002 had students touch a communication card as an alternative behavior to throwing material. For example, teaching kids to say, "Oh man," instead of cursing, or saying "congratulations" after losing a game rather than crying. Remember, we discussed functional communication training. Functional communication training is a DRA procedure. Teaching a learner to use a picture card, sign, or a gesture as an alternative behavior rather than screaming. A DRA procedure uses a replacement skill and reinforces that skill rather than the problem behavior. In another research article, the researchers allowed their students to escape a task by using a break card or saying no. Students could escape a task contingent on using one of those two responses and completing tasks which gradually increased over time. So many that have attempted to use a break card will often say that their learner uses the break card non-stop once they've learned the skill. In the DRA schedule, you would need to teach the replacement skill. So you need to prompt the correct behavior, for example, touching the break card, then giving the learner a break and teaching them that contingency. If the learner engages in problem behavior, no break is given, and the practitioner would not give a break. With any procedure that is implemented, we need to fade it. So a learner needs to learn that they can ask for it, and that gets reinforced lots. After, let's say, 3 consecutive days of no problem behaviors and proper use of the break card, then we need to think of how this can be faded. For example, suppose you used a break card. You reinforce the use of the break card on an FR1 schedule, which means you reinforce the occurrence of it every single time. Later, you associate the break card contingent on completing a task. This would be a simple task, something the learner can do without an issue. Then the learner completes the task, then they get a break, gradually increasing the number of tasks before access to the break. Then you can also look at increasing the difficulty of the task. But your goal here is to replace the problem behavior with a desirable one. This diagram here shows you that problem behavior can result in access to escaping the table, but so can the break card. So we want to encourage the more desirable behavior. A DRA or DRI procedure can be used for a variety of behaviors. If your learner is off task, you can reinforce those incompatible behaviors, looking at their work, doing their actual work, such as writing. Self-stimulatory behaviors, you can reinforce hands down, quiet, but you can also reinforce an alternative behavior. Imagine your learner engages in hand flapping as the learner enjoys the shaking motion. An alternative behavior may be to give the learner ribbons to shake, tambourines to shake, or a maraca. Remember, it's important to replace self-stimulatory behaviors rather than just simply stopping them altogether. If your learner enjoys watching dust floating around the room, an alternative behavior may be to blow bubbles, or even teach the learner to blow the bubbles themselves and watch them. For non-compliant type behaviors, one can reinforce compliance, following instructions. Learners that engage in aggressive behaviors, such as kicking, hitting, or even verbal aggression like cursing, can be reinforced for using alternative words and actions, such as saying, "Oh no," "Oh man," or punching their hand. Running in the classroom, you can reinforce sitting behavior. You can also replace the running behavior in the classroom with teaching the learner to jump on the trampoline or run outside. They can also be taught to request a movement break of some sort if they require that movement. Sitting for long periods of time can do that, and especially children that need to get the energy out. They need to run. That's what kids are great at. If you ever watch children, they're always on the move. They're running and jumping and climbing. Most often I recommend that parents with very active children to enroll them in things like gymnastics or a dance class or swimming. It's important that we understand where this behavior is coming from and not just to stop the behavior, but replace them with something more appropriate. In a school setting or a teaching setting, sitting in seat or during circle time, walking in the classroom are all very important skills. So it's a matter of determining whether we're replacing it or teaching the incompatible behavior. Selecting the appropriate incompatible or alternative behavior is important. We can't just pick any behavior. We need to select a behavior that is in the learner's repertoire. If it is not in the learner's repertoire, then we need to teach it. The alternative behavior must require less effort than the problem behavior. Otherwise, the learner will not engage in the desirable behavior. If the learner is using a communicative device to request and is required to open the application, go into 3 folders to get into the request for the break, and needs to type it out, "I need break," for example. Since this behavior requires a lot of effort, chances are the learner will go to the problem behavior because the scream or kick was much easier. So be sure that the replacement skill or incompatible behavior is easier and will allow the learner to be successful. And lastly, we want to ensure that the behavior is likely to be reinforced after intervention has stopped. We don't want to teach a behavior, reinforce it at school, but then it doesn't get reinforced anywhere else. If a behavior doesn't access reinforcement in other environments, we can't guarantee that the new behavior will successfully take over the problem behavior. Also, if the problem behavior is reinforced more often than the desirable behavior, the new desired behavior will not be strengthened. So it's important when new behavior is being reinforced that it is reinforced in all environments and the behavior we're trying to decrease is not reinforced anywhere else. This is a common issue we're faced with in practice. For example, a learner runs and eats. The treatment center has introduced a DRI procedure to increase sitting and eating and decrease running and eating. Imagine you're working hard and seeing that the running and eating behavior is decreasing, and the learner is now sitting and eating at the table like his peers. You do a home visit and you notice that the babysitter allows the learner to run and eat in the home environment. After a few weeks, you notice that the behavior has not improved significantly and seems to fluctuate. So this is an issue. What you're working on at the treatment center is being undone in the home environment. Therefore, it's important to have all those involved be on the same page for the best results. Often, I'll meet with school teachers, parents, and anyone else involved to share what strategies that we're using, how to do it, and coach them on proper implementation. Remember, the reinforcers need to be selected according to the function of the behavior. Give the reinforcer immediately and consistently on the occurrence of the desired behavior, and do not reinforce the problem behavior. Okay, let's practice. Jackie is 16 years old. She gets really angry when she makes academic errors. She curses her teachers and flips over her desk. The teacher sends her to the principal's office consistently. The behavior analyst on the team has assigned you to train the teacher on using a DRA procedure. What is the problem? I want you to think about that for just a moment. You should have indicated that it's an aggressive behavior in the form of cursing and flipping over the desk. What would be an appropriate alternative behavior? Well, she can request for help. She could say things like, "Oh man." She could take a deep breath before attempting to complete her work. Okay, so here's another example. Dave is 7 years old. When he makes a mistake on his worksheet, he scribbles all over the worksheet. The behavior analyst suggested a DRA procedure. What would be a good replacement behavior? So think about this for a moment. So rather than scribbling on the page because he made a mistake, how about teaching him to use an eraser? I had a learner that engaged in this behavior. Once we taught him to erase his work, the problem behaviors decreased significantly. All right, let's recap quickly. A DRI procedure is altering the problem behavior with an incompatible behavior, and a DRA schedule is replacing the problem behavior with something equivalent to it. All right, let's talk DRO. A DRO procedure is when you reinforce the absence of the problem behavior. So when the behavior is not occurring, you would reinforce on a given interval. Interval DRO or momentary DRO can be used. Interval DRO is when the behavior did not occur at all during the interval, while momentary DRO is when the behavior did not occur in that moment. If your supervisor asked you to do a 10-second interval DRO, then you would set 10 seconds on your stopwatch. The behavior did not occur during that time, you would reinforce. If the problem behavior occurred, you would not reinforce. If your supervisor asked you to do a 15-second momentary DRO, you would let the 15 seconds pass, then look up at that moment to see if the problem behavior is occurring or not. If not, then you would reinforce. Fixed interval DRO, is when you provide the reinforcer at the end of the interval if the problem behavior did not occur. If problem behaviors have occurred, you can reset your timer. Allen and colleagues in 1982 applied an FI DRO to a class that engaged in disruptive behaviors. The timer was set to 5 minutes. If the students did not engage in disruptive behaviors during the 5 minutes, they received a 1 minute of free time, which they accumulated and used at the end of the day. With fixed intervals, the interval time stays constant, 5 minutes or 10 minutes. It doesn't vary in any way. Cowdrey, Iwata, and Pace, 1990, used an FI DRO with a 9-year-old boy who engaged in scratching and rubbing off his skin that resulted in open lesions all over his body. They praised using tokens contingent on 2-minute intervals of no scratching or skin rubbing. If he scratched, the experimenters walked into the room and told him he did not earn the penny and to try again. The behaviors dropped significantly. Variable interval DRO. In the absence of the target behavior during an average length of time, the learner is reinforced. For example, a learner is reinforced on an average of 30 seconds. So the learner could be reinforced at 3 seconds, 10 seconds, 25 seconds, 15 seconds, 4 seconds, and so on. In the absence of the behavior, based on a predetermined variable time, the learner is reinforced. When using variable schedules of reinforcement at the center, I created this random selection card procedure where we indicated the variable interval on these cards. So you can put 15 seconds, 25 seconds, 5 seconds, and so on. Then you pick one up out of the bag or from the hat. If you get 15 seconds, then your VI interval is 15 seconds. That way you can ensure that your schedule is variable. Think of that slot machine at the casino. You pull the handle and you never know when that reinforcer will come, when you'll win that jackpot. A variable interval is the same concept. The learner cannot predict the reinforcer. Momentary DRO is when the learner is reinforced if the problem behavior did not occur at the end of that interval. VMDRO was used by Lindbergh and colleagues in 1999 on a 50-year-old woman with severe aggression, which was maintained by attention. The therapist provided attention at the end of the interval if the behavior did not occur in that moment. The behavior decreased significantly. All right, before we continue, let's do a secret word. And the secret word is spaceship. Okay. Remember, it's spaceship. Okay, let's practice and get into some examples here. Jason is 7 years old and engages in trichotillomania, a hair-pulling disorder. Due to this disorder, Jason has bald spots on his head. The behavior analyst decided to use an FI DRO. What behavior will the RBT reinforce? Remember, a DRO is when you reinforce the absence of the problem behavior. So, as long as hair pulling did not occur during that fixed interval time, then you can reinforce. Okay, here's another example. Monica is 29 years old and engages in excessive eating. The behavior analyst on the team suggested a VI DRO of 1 hour. What behavior will be reinforced? Again, you're reinforcing the absence of eating. So if during that hour she did not eat, you would reinforce. But remember, this is a variable interval, so it can vary in time, but the average time is about 1 hour. Okay, great work, everyone. Let's talk about DRL procedures. Differential reinforcement of low rates of behavior, DRL, is a schedule in which a minimum amount of time must pass between responses in order for reinforcement to occur. This was first described by Forster and Skinner in 1957. DRL is used to decrease a behavior that occurs too frequently, but not to eliminate it completely. For example, a learner that raises his hand during class to answer questions all the time. A teacher may want to decrease that behavior so that it isn't happening so frequently, But we don't want to eliminate this behavior altogether because it's a good behavior. We want to just make it less frequent. Imagine a child that talks a lot. You don't want to stop them from talking, but you just want them to maybe just talk less. An individual that eats a lot and constantly, again, you don't want them to stop eating, but you want them to reduce the intake of food. Research has shown the effectiveness of the use of DRL schedules and found that it has been successful in decreasing rapid eating, decreasing self-stimulatory behaviors, and decreasing raising hands and asking questions. Many of these behaviors are great ones. But if you're a teacher, you can't have a student ask a question every second. You'd never be able to teach and continue with your lesson. I had a learner that was working on reading. We were excited that he was reading and enjoying the idea of reading. As he would read a couple of words, he would talk about the picture in the book. At first, we let that go because he was expressing and describing really well. But eventually, it got in the way of reading. So we had to decrease the talking during reading using a DRL procedure. There are 3 ways of using a DRL procedure. Let's walk you through them. First is a full session DRL, which is when reinforcement is delivered at the end of the session if the behavior was equal to or below a predetermined criterion. This is a great procedure for a classroom setting for disruptive behaviors. For example, a learner bangs the table about 15 times during math class, which is a 40-minute long class. The criteria to receive a reinforcer at the end of the session is 10 or less bangs on the table during that 40 minutes. If the learner engages in 10 or less, he would get access to the reinforcer. Turner and colleagues in 1990 used full session DRL to reduce inappropriate verbal and physical behaviors of a 21-year-old man with traumatic brain injury. They decreased the behavior while increasing the length of the session. Alderman and Knight in 1997 demonstrated the utility of full session DRL in reducing physical and verbal aggression in 3 participants with brain injuries. This was done by gradually reducing the number of responses allowed per session and increasing the total session time. The authors showed success in reducing target behaviors. Interval DRL is when the session is divided into equal intervals and the reinforcer is given at the end of each interval if the behavior was equal to or less than the criterion. If problem behavior occurs, the interval is reset and delays the reinforcer. For example, a 1-hour session would be divided into 15-minute segments. Only one behavior can occur per 15 minutes. If it exceeds that amount, the interval is reset. When using DRL procedures, the interval duration is increased gradually to further reduce the behavior. Studies conducted have shown that problem behaviors such as not raising one's hand before speaking to engaging in physical aggression and property destruction was reduced by using DRL. Teachers told the children the maximum number of responses that they could make within each interval, usually 2 to 5 minutes, and provided rewards contingent on meeting the criterion for a particular number of intervals. A DRL procedure is great to decrease a lot of behaviors and easy to use in a school setting. Handon and colleagues in 1984 used a similar procedure to reduce repetitive speech. The adolescent received a token for emitting fewer than the target number of repetitions per interval. The repetitive speech was reduced, so there's a lot of research to support the use of DRL. Spaced responding DRL is when a reinforcer is provided after a specific amount of time has passed from the previous behavior. So here, you need to wait before the learner can access the reinforcer. a predetermined time must pass before they can engage in that behavior. For example, someone that eats quickly will need to slow their pace. This can be done by reinforcing them for taking a bite, then waiting, let's say, 30 seconds before picking up the spoon again. Having this would encourage the learner to eat slowly. The use of full session DRL may be the best procedure to use in the classroom because it has less observation sessions than the other DRL procedures. Because with full session DRL, you're reinforcing the behavior at the end of the session, rather than dividing up the time or using the space responding DRL. All right, let's practice. Mike is very inquisitive, and he asks a lot of questions. You're unable to help him with his homework, so you speak to your supervisor about this issue. Your supervisor suggests using a DRL procedure. She suggested an interval DRL for the hour. She wants him to ask no more than 12 questions. How would you set this up? Remember, with an interval DRL, you need to divide the session equally. So since we know it's an hour, you'll have 15-minute segments. Your supervisor doesn't want him to engage in more than 12 for the hour, which means he can ask 3 questions every 3 minutes. Mo scratches his head a lot. It seems constant. There does not seem to be any reason why he does, but appears to be maintained by automatic reinforcement. The BCBA suggested using spaced responding DRL, reinforcing every 45 seconds. How would you set this up? So Mo would not be able to engage in the behavior for 45 seconds. Then once that time has passed, he can scratch his head. So remember, with a DRL procedure, you're decreasing the frequency of the behavior. If you're a teacher, therapist, or parent, think of how many behaviors that you'd love to decrease, but not get rid of. I have a nephew who is 6 years old. He loves to hang out with me, and when he comes over, he takes over. He'll literally talk the entire time that he's with us. I love it, but sometimes it would be nice if he didn't chat as much. So if you have someone like that in your life, a DRL may be a great option. So here's a chart to help you differentiate between the procedures. Remember, a DRI procedure, you're basically doing the opposite of that problem behavior. If the problem behavior is running, then sitting would conflict with that. If throwing is the problem behavior, then teaching hands down and reinforcing that would be the opposite. A DRA procedure is teaching something functionally equivalent to it. So what's the function? Now replace it with something more appropriate. So if the learner is cursing, teaching them to say, "Oh man," or "Oh shoot." If the learner is crying for cookie, teaching them to ask for it. A DRO is when you reinforce the absence of the problem behavior. If the learner is hitting, you would reinforce when hitting is not occurring. And the DRL is reducing the frequency of that behavior. Okay, everyone, let's get into the quiz. We've talked about a lot, so let's see how you do. Good luck. Your supervisor has asked you to reinforce the absence of the target behavior. What differential reinforcement procedure is being used? A, DRA, B, DRI, C, DRO, or D, DRL? And the correct response is C, DRO. Your supervisor has asked you to reinforce the replacement behavior and ignore the problem behavior. What differential reinforcement procedure is being used? A, DRA, B, DRI, C, DRO, or D, DRL? And the correct response is A, DRA. Your learner is engaging in out-of-seat behavior. Your supervisor has asked you to reinforce the learner when they are sitting down every 3 minutes. What differential reinforcement procedure is being used? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is B. DRI. Well done. Your learner is talking a lot during circle time and disrupting the group. You want to reduce the behavior. Your supervisor has asked you to tell your learner that he can only ask 3 questions during the 10-minute circle time. If he asks more than 3 questions, he cannot access the reinforcer. What differential reinforcement procedure is being used? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is D. DRL. Tommy is a fast eater. He takes bite after bite and fills his mouth with food. The RBT is worried about him choking. The supervisor suggests reinforcing the latency between bites. What differential reinforcement procedure reinforces between responses? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is D. DRL. The supervisor tells the RBT to reinforce pointing to the reinforcer rather than the scream. What differential reinforcement procedure is that? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is A. DRA. The supervisor tells the RBT to reinforce quiet and reset the timer if the learner talks during the interval. What differential reinforcement procedure is that? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is C. DRO. The RBT works with a 4-year-old girl with autism. The little girl jumps up and down in her seat during intensive training. The RBT typically says, "Stop jumping in your seat, sit still, or you don't get to play." A functional behavior assessment indicates that the behavior is maintained by attention. A DRA procedure is used. Which of the following would be an appropriate example of DRA in this case? A. Providing attention whenever the learner says anything appropriate to the RBT while ignoring her if she jumps up and down in her seat. B. Providing attention whenever the learner makes an appropriate greeting to the RBT, such as hello, while ignoring her inappropriate greetings. C. Providing increased attention to her throughout the day. Or D. Ignoring all of her inappropriate behaviors. And the correct response is B. Providing attention when the learner makes an appropriate greeting to the RBT, such as hello, while ignoring her inappropriate greetings. Differential reinforcement always includes A. Reinforcement and punishment, B. Reinforcement and DRO, C. Extinction and punishment, or D. Extinction and reinforcement. And the correct response is D. Extinction and reinforcement. Tommy engages in mouthing non-food items such as toys and Play-Doh. An assessment determined that the behavior was maintained by automatic reinforcement. Each time Tommy attempts to place the toy in his mouth, the RBT redirects Tommy to his chew toy. When Tommy places the chew toy in his mouth, you reinforce verbally. When he chews a toy, you block it and redirect. What procedure are you using? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is A. DRA. Sarah engages in aggressive behavior to escape a demand. When given a task, Sarah immediately reaches across the table to hit the RBT. You physically block the hit and immediately hand her a break card. When Sarah gives you the break card, you immediately give her a break. What procedure are you using? A. DRA, B. DRI, C. DRO, or D. DRL? And the correct response is A. DRA. This is when a reinforcer is provided after a specific amount of time has passed from the previous behavior. A. Spaced responding DRO, B. Spaced responding DRL, C. Responding, or D. None of the above. And the correct response is B. Spaced responding DRL. Differential reinforcement is A. An operant procedure, B. An antecedent intervention, C. An error correction, or D. All of the above. And the correct response is A. An operant procedure. Differential reinforcement of incompatible behaviors is defined as A. Weaken problem behavior while strengthening adaptive behavior, B. Reinforces a desirable alternative behavior while the problem behavior is no longer reinforced, C. Reinforce the absence of the problem behavior, D. Used to decrease a behavior that occurs too frequently but not to eliminate it completely. And the correct response is A. Weaken problem behavior while strengthening adaptive behavior. Differential reinforcement of low rates of behavior is defined as A. Weaken problem behavior while strengthening adaptive behavior, B. Reinforces a desired alternative behavior while the problem behavior is no longer reinforced, C. Reinforce the absence of problem behavior, D. Used to decrease a behavior that occurs too frequently but not to eliminate it completely. And the correct response is D. Used to decrease a behavior that occurs too frequently but not to eliminate it completely. Differential reinforcement of other behaviors is defined as A. Weaken problem behavior while strengthening adaptive behavior, B. Reinforces a desirable alternative behavior while the problem behavior is no longer reinforced, C. Reinforce the absence of problem behavior, D. Used to decrease a behavior that occurs too frequently but not to eliminate it completely. And the correct response is C. Reinforce the absence of the problem behavior. Well done. Differential reinforcement of alternative behaviors is defined as A. Weaken problem behavior while strengthening adaptive behavior, B. Reinforces a desirable alternative behavior while the problem behavior is no longer reinforced, C. Reinforce the absence of the problem behavior, or D. Used to decrease a behavior that occurs too frequently but not to eliminate it completely. And the correct response is B. reinforces a desirable alternative behavior while the problem behavior is no longer reinforced. All right, my final thoughts. Operant procedures such as differential reinforcement practices are important in changing behavior. Remember, our goal is to support our learners and shape their behaviors to be appropriate so that we're helping them improve their quality of life. You're shaping behaviors that are socially significant and important to the learner and their family. To change behavior, one must have access to reinforcement. So if you're not reinforcing a behavior immediately, contingently, and consistently, and using a good amount of that reinforcer, then you may not have success in shaping that behavior. You want to remember that reinforcing any behavior is not what you want. You want to shape the best behavior to get the best performance. What you permit, you promote. So if you have a student that does their work in a sloppy manner or asks for items while looking away rather than giving you eye contact, well, you're shaping that behavior. So think of the behavior that you want. Work slowly and gradually towards that terminal behavior. If you want your learner to look at you and ask nicely using a full sentence, you may start with reinforcing one-word requests without eye contact, then two with eye contact, then a full sentence, and maintaining that eye contact. You can't do it all together, otherwise it'll be too effortful and you'll get escape behaviors. So work towards getting the best responses. Don't allow learners to get away with responding in a sloppy way. For example, picking their nose while answering questions, engaging in self-stimulatory behaviors at the table, or shouting out during circle time. Teach them the appropriate behaviors by reinforcing what you want or the absence of that behavior. Our role as educators is to give our learners the best teaching practices out there and help them reach their full potential. And that's why you're taking these courses and training, because you're driven to support and help. Keep up the great work, and I'll see you at our next class. Thank you for joining me today. So let's talk about differential reinforcement. And one of the first ones is differential reinforcement of other behaviors. So if your learner is, sitting down and you're working at the table with them, whatever the problem behavior is, it doesn't matter. I'm going to reinforce other behaviors. So I like how you're sitting, good walking, nice looking at me, great high five, whatever it may be, I'm reinforcing other behaviors and I'm not focused on the problem behavior. So that's one. So again, with my learner, if I was sitting here and they're doing whatever it is that I want them to do, I might just say to them, I love how you're sitting. Good job. Give me a high five. Nice work. Okay, and I'm teaching them. And then I might say, I love how you just listened to me. That was great. And so on. Now, when we're looking at differential reinforcement of incompatible behaviors, I'm now looking at what is incompatible with the problem behavior. So let's suppose that my learner, always flaps their hands, okay? And so if their hands are flapping, I'm not gonna respond to that behavior, but what I am gonna do is respond to the appropriate behavior, which is the incompatible one, which is their hands down. So here's my learner and their hands are down, which is great. So I'm gonna say, great, hands down, good job. Now let's suppose that they're flapping their hands, or they're moving their hands or doing whatever it is with their hands. I'm not going to reinforce this behavior. Once their hands are down, then I'm going to say, great, hands down, or whatever the procedure is. Now, of course, you're going to have to follow what the protocol is and the procedure is for this. But what I'm trying to show you is you can't be flapping your hands and have hands still. And we talked about that. You can't be standing up and sitting down at the same time. So if your learner is the type that wanders around or gets up and leaves the table, and I'm trying to reinforce the incompatible behavior, it would be the behavior of sitting down. Or if it was walking and running, I'm looking at, let's say, the walking behavior, and that's what I'm going to reinforce. If they start running, I'm not going to reinforce that behavior, okay? When we're looking at differential reinforcement of alternative behaviors, I'm now looking at a behavior that is alternative to the problem behavior. So again, suppose that the learner needed to ask for an item. So let's say they wanted, let's go back to the pylon, and they wanted the pylon, and they were reaching for it and attempting to grab it. Okay, so they're grabbing it and they're trying to reach for it. Now that's not the appropriate behavior that I want. So I might, whatever the protocol again is, depending, let's suppose that I had to redirect their hands, and now the alternative behavior is to teach them to say, I want pylon. I want pylon. And they say it, and now I can reinforce the alternative behavior. Now, if you think about that, we now know that differential reinforcement of alternative behavior is like functional communication training when it comes to requesting and things like that. So here I'm trying to get them to ask for something appropriately, and that's the alternative behavior. Rather than them grabbing, they can now say that they want. And this would apply for anything else. If they wanted your attention, rather than going, teacher, 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 and doing one of those, you could teach them to just say, tap on my shoulder and say, excuse me, and then you can attend to them. So that's an alternative behavior for that attention type behavior. What about if they wanted to leave the table and escape the task or escape the skill that they're working on? Well, rather than them just leaving the table or running away or screaming and throwing the table, I might teach an alternative, and in that moment I might have them touch a break card or ask for a break, and then I can allow them to leave when they ask for it appropriately. Okay, and the last one that we have is differential reinforcement of low rate behavior. So this is one where if your learner does something a lot, you want to just decrease the behavior and not get rid of it completely. So again, if you were doing something like circle time and you were asking the learners to respond to questions, you always had that one learner that always put their hand up or was always shouting out or whatever it may be, well, you may not want them to stop raising their hand, but now what you want to do is get them to only raise their hand sometimes. And so again, this may look like having a predetermined number of times that they can respond in, let's say, a 15-minute circle time. So they're allowed to respond 5 times, and that's it. So if, let's say, the procedure was to actually tell the learner that you have 5 questions that you can answer during circle time, and the rest are other opportunities for your other friends, then if they raise their hand, I might say, okay, that's 1, and I put a check mark for that's 1 completed, and then I might ask another friend, and so that we're working on reducing that behavior, but again, not getting rid of it completely. So those are your different differential reinforcement strategies and the comparison between them, and how to implement it in practice if you were doing it with a learner.